All right. Welcome, everyone, to our cultural humility training sponsored by the Department of Public Health and in collaboration between the Georgia State University School of Public Health Prevention Research Center and the International Rescue Committee. So today I'm going to hand it off now to Val, who's going to lead a brief introduction. Go ahead, Val.
So hello, everyone, and welcome to our Cultural Humility webinar series. Today we're focusing on Venezuela. We'll begin with a short snapshot of the country and then present our panelists. Just a little bit about me. My name is Valentina Parlatisi. I was born in Caracas, Venezuela, and I moved here with my family when I was about 5 years old. I'm a graduate student currently at GSU, working on the cultural humility trainings for the Georgia RIM Mental Health Alliance, which is a collaborative that aims to expand mental health services for refugees and migrants across Georgia. Okay, and we can go to the next slide. So to start, Venezuela's official name is the Bolivarian Republic of Venezuela. It lies on the northern coast of South America. It's bordered by land with Colombia, Guyana, and Brazil. There's a group of islands, including Los Roques archipelago off the coast of Venezuela in the Caribbean Sea, that are also federal dependencies. Los Roques, which I pictured here right above, is a really beautiful clustering of over 300 islands and cays that surround a central lagoon. The government named it a national park for its rich wildlife and biodiversity in 1972. The capital and largest city is Caracas, pictured here. It's a center of industry, commerce, and culture in Venezuela. The most prominent historical figure is Simón Bolívar, which is also pictured here, for whom the Venezuelan currency is named. He was a military and political leader that helped lead Venezuela and other countries to independence from the Spanish Empire in the 1800s. More recently, though, his name's been used by politicians as a powerful propaganda tool to symbolize patriotism and bolster support for socialist ideals and for the government of Hugo Chavez, who was president of Venezuela from 1999 until his death in 2013. Bolivarianism is a term that's often used to refer to Chavez's government specifically. Venezuelans are predominantly Roman Catholic and have a strong patriarchal social structure and kind of an unofficial class system. So meaning that racial and demographic characteristics heavily influence the social class structure of the country. They have a rich musical heritage and dance culture, and exposure to traditional folk music and dance usually starts at a very young age. Here I also showcase just some interesting facts about the country. It boasts the second highest number of Miss Universes in the world, second only to the US. It has the largest known oil reserves. So just a fun fact, a gallon of gas would cost about a nickel in US currency. And next slide. Okay. So these next two slides are a kind of timeline that cover just important events over the last 3 decades that have led to the current crisis. I'm not going to go over them individually, but this particular slide covers the slow kind of erosion of freedom of the press and the increases in government oversight of key industries. In the late 90s, there was a huge amount of social spending by the Chavez government aimed at increasing housing and reducing crime. And while they did work for a time, they were kind of dependent on responsible fiscal policy and a thriving economy, which the government did not spend as much in. The government nationalized the oil industry, but didn't really invest in its maintenance, which led to deteriorating oil production. And then, of course, pervasive corruption and poor policymaking also attributed to the economic decline of this time. And this worsened under Nicolas Maduro's presidency that started in 2013 with hyperinflation and severe drops in oil prices. The time was also marked by many violent protests across the country, which were met with severe government crackdowns and human rights abuses. I've put some headlines of the times up here, so to kind of show what was in the news at the time. Next slide. Okay. So in the following years, the refugee crisis deepened as people fled violence, crime, starvation, and poverty. The healthcare system virtually collapsed, especially after COVID in 2020. In 2023, the US eased sanctions on Venezuelan oil to help relieve the economic collapse, with the caveat that free elections would be held in 2024. And we can go to the next slide, which kind of leads us to today. So very recently, Maduro's government has denied the leading opposition candidate from holding public office, and multiple aides on her team have been arrested since January. So there's significant speculation surrounding the prospect of free elections in 2024. There's currently about 7 million Venezuelan refugees that are displaced, with Colombia hosting most of them. This picture that I put here is from a few years back, and it's Venezuelans at the Colombian border. And although the Colombian government had relatively friendly migrant policies towards Venezuelans, they've faced increased scrutiny and backlash over the years. These migrants are suffering extreme conditions and rampant xenophobia, especially in other Latin countries, which may be why migration back to Venezuela has begun to rise again, and more migrants are making the dangerous journey across the Darien Gap to reach Mexico and the US. Next slide. Okay, so this next slide kind of graphically shows these migration patterns over time. I use data from the World Bank to make the graphs. Here on the left, you can see that net migration begins to drop significantly around 2005. So meaning more people are leaving than are coming in. And previous to this time period, and for decades, net migration was very stable and very balanced. In the same time period on the right, you can see how crime steadily increased at the same time that people were kind of fleeing the country in droves. And if you were to take a look at the data bank and visualize them in graphs at statistics of poverty, hunger, infant mortality, you would see very similar patterns across this specific time period. Okay, so next slide. So that is it for me. And now I'd love to throw it over to the panel. We're honored to have 3 amazing panelists here to provide more personal insights into the crisis. They'll be introducing themselves, and then we'll have a little question and answer session and opportunities for the audience to ask as well. I'm going to hand it over first to Miroslava Kalan, who's a Fulbright scholar from North Carolina State University.
Thank you, Val. Thank you, everyone. Nice to meet you all. It's a pleasure and honor to be here. Thank you for the invite, and it's a pleasure to share this panel with such amazing immigrants and also people who are working for them and by them. You already introduced me. I'm Miroslava Kalan. I'm a political scientist from Universidad Central de Venezuela, the national university of the country, and I'm a Fulbright scholar doing my master's in international studies currently at North Carolina State University. And before that, I lived in Iowa doing my pre-academic course for this master's. And in Iowa, I discovered that my passion was specializing myself in migration, integration, and most specifically, migrants' political rights. This happened because I stayed in Colombia for 6 months. I wasn't planning on it, but many opportunities came up. And also, I was part of the student movement and the opposition movement back when I was in Venezuela. I was one of those students who were protesting during 2017 until 2019. I was a student leader, so that's part of my background as well. I lived in Colombia for 6 months, or stayed in Colombia for 6 months, and then I was granted with this scholarship. And I moved to Iowa first during 9 months, and then I moved to North Carolina. So in Iowa, after living all this in the border, where I was the chief of campaign of a Colombian Venezuelan candidate to the Senate, I shared a lot of stories, and I designed policies for immigrants in this campaign. And also I faced most of the challenges that any Venezuelan faces in Colombia, such as xenophobia, illegal pathways for getting into the country. Also, all the struggles that immigrants have to legalize themselves and getting access to work permits, and how the bureaucracy works against this process, and it's not smoothly coordinated with the migration offices. So there is where I realized that that was what I wanted to do, and I was asking myself, like, how does this happen? Why does this happen? And then when I arrived to the United States and the border crisis uphold, then I realized that this happens because this happened because the easiest way to go against a population is going against foreigners, since foreigners are not politically relevant because they do not have access to voting rights. And that was the way I realized that this was the research topic I wanted to specialize myself as well. How does voting rights facilitate immigrants' integration? Since this is a pilot plan that it's been developed in Europe, Switzerland, Netherlands, and then afterwards in the United States in 3 different states, only allowing immigrants to vote in local elections. So I've been specializing myself in this for 2 or 3 years. I'm pretty proud of it. I categorize myself as a migrant as well, even though I'm here under a student visa, and my conditions for arrival were pretty different. I arrived here under the Department of State sponsorship, and I arrived here under a different condition under our scholarship. But I have not been apart from not only Venezuelans, but Latin Americans struggles towards regularization and also towards integration as a whole. And I'm talking about the entire migration crisis in the Americas from the south to northwards. So I haven't been apart from it. I have been doing research about it. And with this border crisis and the midterm election during 2022, I did this research about how immigrants are the easiest topic for getting into the media, and then being positionized into the media because immigrants who cross the border or who are not citizens yet, they have no access to voting rights. So they are not a population that it's politically targeted by politicians. And finally, I think that also being part of being involved in different migration dynamics in different states, such as Florida. If we go here to the south, we can see internal migration flow from Florida to other southern states, such as North Carolina, Georgia, and we have seen how Venezuelan migrants mostly, but I was reading a news report about that immigrants are not coming only from Venezuela. Ecuadorians and Colombians are racing right now, also crossing not only the Darien, but also getting into Mexico. So yeah, this has been my entire path. Hope to hear from my colleagues as well on their path, and of course connecting with them, since we are doing incredible and positive movements towards immigration. Thank you.
Thank you so much, Mirsilva. That was amazing. And you provided so much great information for all of us to kind of take in. So next up, I do want to invite Ina Flores. She is Assistant Director of the Emory Latino Diabetes Program. So go ahead and take it away, Ina.
Hi, everyone. Thank you for inviting me. It's a pleasure to be with all of you, and especially with Pedro, that we know since long back ago. So I am older than all of you, and I really like the idea that the picture that Val put in. If you can put that back, I will like to talk about it, because that reflects why I'm here. So is the one that you put like 19 when Chavez was elected, and then all the situation that happened? Okay, you know my age by now, but if you put that there, in 1998, I remember I was in high school, and Chavez was the first time going to elections, and our family was not Chavista, that's how we call it, and it was a big, I remember it was a big movement. I remember when he won. I remember all the situation that happened, and I didn't understood what was going to happen in my life to that situation. But I saw also I have to say my father is a petroleum engineer, used to work in PDVSA, and my mom too, both of them. So I grew up in oil all my life. Used to go to the refineries. I grew up in PDVSA. That was my parents' work. I used to go to the library there, and that was my life, PDVSA, oil engineering. My grandfather was also, when the Shell company moved to Venezuela, Maracaibo, my grandfather at 17 years old started working in the Shell company when the boom was growing. So I am part of this Venezuelan movement that grew up with oil. So my grandfather was a fisherman, like no man because he was a teenager, but he was helping his father to get fish from the Maracaibo Lake. And then oil came out, and then companies came, and then he started doing wilderness, working in the Shell company. And then when he learned many things at 50 years old, he opened a company. And that's how our family law for the United States and oil and came up. So I have to tell you that part of me. And so growing up in the oil company, we were very affected by the Chavismo. So my mom was fired by Chavez in the newspaper. That was really terrible in 2002. And we saw how the country was deteriorating, how the company, if you were not Chavista, were not in the part of the political situation, you would not work. And I graduated in 2002 I am a dietitian studying nutrition in Venezuela. So I was working, but if you're not part of the government, you couldn't work. So I was working in the hospital. My first job, that's why I know Pedro, is because his family had a company back in Venezuela. And that was my first job, working with his family. So I was working there, and I was working in the hospital in Maracaibo. And also I was doing in the afternoon I was doing private practice. So all of that happened, but Chavez started bringing people from Cuba to the hospitals. So in 2008, he fired me because they put dietitians and healthcare providers in the hospital to enculturate the poor, to tell them we're better, and the Cubans were telling them the communism sign. So I was left without that job. And also soon after, Pedro's family also migrated to the United States. So I was working in their company too, but everything was collapsing to me. Like my job in the hospital, another job was pending. I didn't know what to do. The money that I was making was not enough for me to I was 25 years old, so I couldn't buy a car. I couldn't buy anything for my future. So at one point, my mom was fired by Chavez, so she was at home. My father couldn't get a job because he had a company, and he was not Chavista at that time, and he couldn't get. So all that I grew up, like all the wealth that my grandfather lived from the oil. My parents, studying also, my father came to the United States studying at Stanford University with that Venezuela abundance. So we were all educated. We had all these resources, but my generation couldn't sustain it. We couldn't get a car. We couldn't get enough job. Our life was not enough at that time. So as a younger person, I was like, I was in that situation. What do I do? Chavez is taking over everything, and I don't have future. So that's why I decided to move to the United States, to say, okay, I have family in the United States, and I came on a student visa. I studied in Georgia State English, and that started my journey. That's why I'm here. So when I move here, everything, because that's so important. Like when I moved here in 2007, we didn't have all the rights. Venezuela didn't have political asylum. Venezuela didn't have TPS. Venezuela could not work. So that's a huge difference from now, because my generation of my immigrants, we have to stay as a student visa or work in another thing. But now Venezuelans can get access to little bit access to care if you have the knowledge that we're going to talk about in different, but that's kind of like the benefit of this immigration than the past immigration, that, for example, I didn't have access to all the things that I could have now. That's why I wanted to share that. So I studied here, I studied English and applied for school. I went to NYU University to do my master in clinical nutrition. And then since then, I have to understand who I am in this country and what I'm gonna serve. What is my purpose in this place where, or how can be assimilated, understand what is my role? Because my dream to work in a hospital, in an ICU environment, that's not what's needed in this country. And the need in this country was to help Latino communities. And that's how the people that I work in Mount Sinai Hospital and NYU Hospital see me as an immigrant, as a person that can bring the gap, that understood healthcare with the public, with the Latino community. So that's how my love for helping Latino community grew, or that's what I do for a living, to help refugees community, people that need access to care, to help them to understand the system and prevent complications. So I used to live in New York City for 7 years, and then I moved to Atlanta. So that's what I do. I work in Emory University, and I help the Latino community and also other refugee clinics. So I don't want to get more into details, but that's who I am, and that's my passion, to help the Latino community. So thank you so much.
That's amazing, Ina. It was really good to learn more about what you do at Emory and what you did in New York, which I didn't know about. Okay, so next up we have Pedro Valoria, who's the Health and Wellbeing Program Manager for the Latino Community Fund in Georgia.
Awesome. Thank you, Valentina, and thank you again, everybody, for joining us today. I think that if you ask any Venezuelan, we're dying to tell this story. So being able to have this platform to share and talk about our experiences is wonderful. And so thank you, Valentina. My name is Pedro Viloria, and I am the Health and Wellbeing Program Manager for Latino Community Fund, Georgia. I was born in Caracas, Venezuela, but my family actually migrated to Maracaibo, which is where I met Ina when I was a very young boy. And my family actually migrated to Venezuela very much following this pattern that's been shared around 2004. So right after Chavez was elected, and we started seeing kind of the decay of the country. So it was about 20 years ago that we came here, first to Miami, where kind of like the port for Venezuelans. And then we migrated up to Atlanta, where we've been here for the majority of our migration life. And obviously, like most migrant families, we face a lot of challenges. And I think one of the most outspoken ones is the separation and the loneliness. I haven't seen my grandparents for the majority of my life, and my maternal grandparents passed away, and I was only able to share a couple of years with them. And beyond, right, the family separation, you have challenges with language, challenges with accessing resources, navigational challenges in general, as we navigate this new system. And so I think that this is kind of what primed me to pursue my career as a nonprofit professional. And so I graduated from Emory University, which I loved, and I immediately started working in nonprofit organizations, specifically in the healthcare field, working with Access. I worked with Emory as part of their billing team to make sure that Latinx patients were getting, in language services, and also understood what they were being charged for and understood what rights they didn't have. And then that kind of evolved to Galeo, where I worked more about themes of citizenship, processes, voting rights, advocacy, and then ultimately, after the COVID-19 pandemic, I landed in LCF Georgia, which to me has been such a wonderful opportunity to really, really delve into what I am passionate about, which is direct services to community. And so the program was founded in 2020 as a direct response to the pandemic, seeing that a lot of our community members, specifically Latinx community members that were disproportionately being affected by the pandemic, were not having that disproportionate access to testing, to vaccines, and to general information to maintain our community informed. And I think that caused a lot of the hysteria and a lot of the distrust in the system to begin with. And so we did start working with a lot of the vaccine providers like CORE to make sure that there was in-language interpretation available at vaccination events, and that they were hosted in community places like Plaza Fiesta, like the Mexican consulate, and not in places that were otherwise inaccessible to our community. And that has since evolved. Obviously, the pandemic has waned, and the interest in the vaccination efforts has also waned, but we're really focusing now on all of those pre-existing conditions that we then discovered were the reasons why a lot of the COVID cases were becoming fatal. So undiagnosed diabetes, undiagnosed high blood pressure, undiagnosed high cholesterol. And so we've now evolved to offer free screenings at community locations, whether that is businesses, at consulates. So the Mexican consulate, we have the Ventanilla de Salud. At the Salvador consulate, we offer screenings every Thursday and Friday as well. We're at the Latin American Association. And so we really are trying to kind of bridge the gap between healthcare providers and access, where we see that there was a huge chasm during the pandemic that obviously was exacerbated by the pandemic, but has always existed in the American system. And so really now we're trying to not only couple that effort, that screening effort with referral processes, but also education. We also offer workshops. And so all of this is really in the spirit of making sure that community members are comfortable accessing these services. And this is something that we're definitely going to talk about later, about what those challenges are and what is stopping Venezuelan community members from seeking these services. I will say that my experience has been different because I grew up here. And so I think Ina described it very well, right? A lot of the decaying of the system that she had to live through. My parents migrated here to avoid us having to experience that. And so because of that migration, I was able to get an education here. I was able to buy a car, buy a house, and really define my future where there was really no hope in Venezuela. So there really was no option. And I do want to take this time before I go into a tangent to also share that we did release a status of Latino report in 2023, so last year. So all of the information that I'm going to be sharing today is going to be completely directly taken from that report, as well as kind of like our lived experiences on the field, because obviously my experience as a Venezuelan is as a child of immigrants, but I'm very close to community. And it's definitely something that is important to me to make sure that I continue giving back and continue being involved in a community that raised me and you know, that really needs this attention.
That's incredible, Pedro. Thank you so much. I loved learning about what the LCF community fund was doing, and I was really, really proud. And I actually can't wait to get involved myself and my husband. Okay, so next up, I'm going to hand it over. Dr. Owen Smith is going to moderate a little Q&A session, and then we're going to open up the floor to questions. Thank you so much, everyone.
Wow. And thank you to all three of you for sharing those experiences and insights. I already feel like I learned a lot in the last 30 minutes. So I appreciate that. And so maybe what I'd like to do first is just following right up on Pedro, your comments about, you know, what are some of the biggest barriers and challenges that you think Venezuelan refugees and migrants are facing in terms of accessing healthcare services, social services? Where are the biggest challenges and barriers? And I'll start with you, Pedro, and then Miroslava, Ina, if you guys want to jump in, please feel free.
Absolutely. And I think that this question can be answered kind of observing the two facets of the service system, right? We have the actual patient side, and then we have the actual service provider. And so I think first to kind of contextualize when working with Venezuelans, so we're very strong people. We're very stoic, and whether it is as immigrants back home or, you know, back home or immigrants here, we're a country of survivors, because it really is just that. Like, all Venezuelans that are still standing today are fighting for a chance at a normal life. So being at home comes with so many challenges, from inconsistent utility services to general danger of theft, kidnapping, violence. My own family, when we visited, was targeted for one of these. So if you ask any Venezuelan, they have either directly or indirectly been affected or have some degree of association to some traumatic event. Being away from home also comes with a lot of challenges. So first, the navigation of the American system, I think that is such a huge challenge, especially when you chime in the language barriers. Relinquishing entire careers. We're talking about people who are professionals in Venezuela, who are doctors, who are businessmen and women, who are surgeons, and then they come here, and there is no, academic equality here. There is no transference of credits, and so they kind of have to start from the beginning. And we have a lot of people who are surgeons in Venezuela and come here and they're dishwashers, and nothing to devalue that job, but once you go from the top to that, it really takes a toll on your mental health. Finding immigration status, I think there's a very complex story, as Ines stated at the beginning. When we first started migrating, there weren't these immigrant pathways and protections, which have changed, but that's still not a consistent solution, right? TPS is temporary. The refugee and asylum status are also temporary. And so the idea that this is something that is not set in stone and stable already creates a lot of insecurity and mental stress. And then of broken families and loneliness, which I think is really, really important, right? And I think just depression and admitting depression and coming to terms with the fact that we're going through some mental hardship, as difficult as it is. And so when you add that, the fact that, like I said, I hadn't seen my grandparents growing up, I had classmates that would say, oh, I spent this weekend with my cousins, and I haven't seen my cousins in years, And so there is really a big loss of just social credit, and that support system that you lose, you're on your own here. So our entire community, I think, has trauma, collective, generational, personal. And this also means that mental health intervention is difficult because Venezuelans have such a high trauma threshold and will rarely reach out for help unless the situation is dire, which really adds to the kind of general stigma of mental health as only being exclusive to more severe conditions like schizophrenia. And then there's the other layer of, like, in Venezuela, we're not even used to accessing these services to begin with. And so just convincing community members that this is a service that exists here, that is accessible, and that you don't have to only access it when you're in a dire situation is such a big hurdle. And then, you add that to the fact that the materials are not in language, that this is a new system, that there's uncertainty on what you qualify for and what you don't qualify when it comes to insurance and coverage. And then if you don't qualify, right, what are your options? Which there are options, right? There's federally qualified providers. There's community clinics that offer sliding scales, but this is kind of like that gap in knowledge and outreach that needs to be filled in. And that's kind of the work that we're doing with LCF, is trying to bridge that gap. And I think that also means that there needs to be a lot more initiative on providers' end as well. And this is something that we saw during the pandemic. A lot of providers kind of put the brunt on the work on community organizations and community to provide the interpretation, to provide the translated materials. And we didn't really see an interest in the providers to seek out, to treat these people and to have material and education and that outreaches that community and is contextual, right? Taking into consideration that we are a high trauma community, that we generally do not have the culture. And I think that this is true for Venezuelans, but also true in general. I think obviously reaching for mental health is a struggle in itself. And I do think, again, with that comment that I make about being stoic, especially as a migrant, there's a sense that you're abandoning everything. And so that sacrifice needs to be justified. And so their attitudes of, complaining or not being happy with their situation is almost giving credit to the fact that the sacrifice was in vain and that, you're suffering and that there was no reason for you to come here. And so I think that that it's really, really important to understand kind of that context and what's going on as far as the mental health in our community.
Yeah, that's really helpful context, Pedro. Thanks. Yeah, Miroslava, you want to jump in?
Yes, thank you. I think I'm gonna begin with something you just said, Pedro, and it's about the trauma. I just read a report from the Times. It was released I think 3 days ago, and it is about refugees, mostly Venezuelan refugees interviewed, that they are sharing something named collective trauma. This collective trauma is the loss of identity from where you're from because you are being neglected and you are being segregated. And this has happened to most Venezuelans in the United States because of what I already talked about, the background of the border crisis. And this happens as well in other territories. And I'm talking about all across the Americas. I'm talking about Peru, I'm talking about Colombia, I'm talking about Ecuador, because I think that Pedro, and myself, we have seen all the news from different newspapers from Latin America that point out, okay, a Venezuelan was chopped in the middle of the street in Ecuador or in Peru, and it's because they are just doing xenophobic acts. So this collective trauma, it's something that many Venezuelans are experiencing, and it's because of chronic injustice, based on their beliefs and their culture. And since they are not used to, as Pedro said, they are not used to get access to any services, or they do not know that they exist, or they do not know how the system works, then they feel neglected and they feel attacked. I remember that there were many hate speeches and hate videos on TikTok and reels on Instagram from Venezuelans to Venezuelans in the United States about, you guys don't know how to behave because you're listening to music too loud out of the street in Miami or in Georgia, or where we have like larger communities, or when immigrants are living in the streets of New York. And I always say, it's not your role to judge your connational. It's the role of the system and the justice system to judge them and take care of them. So since we don't know how the system works, we begin blaming our own connationals and our own nationality of different behaviors that are not only their responsibility. And this takes me to another topic that I think that it's the biggest, for me, the biggest challenge for Venezuelans right now is the access to their work permit. There was a report 4 days ago from Seattle. So we all know that immigrants had been bossed to different states: Washington State, Illinois, the DMV area, etc. So these immigrants are mostly living in tents or camps in public streets because their time in the shelters has ended. And since they have been doing like different programs for them to get into other shelters or into hotels as a temporary housing, there is a tiny piece of the story that is missing, and is that most media publishes or posts that they are just living in the street, but they do not post that they are doing that because they haven't had access to their work permits. So in the bureaucratic process of getting of legalizing yourself, for example, most of them have crossed the border because they are claiming for asylum, and their case is still pending, but their social security number or their work permit hasn't arrived. So if you're screening someone once someone has already had their CBP1 app appointment, or when they crossed the border 2 years ago because they were allowed to, if you already did the screening process, why do you delay a year, 2 years, or 3 years to get their permit? So you're not involving or integrating these immigrants into the labor force. You are pushing them to vulnerability, and you're pushing them to work illegally. So that's, for me, the biggest challenge towards integration that most immigrants have. And also that immigrants, mostly that they come through the border, which is the larger range right now, this is their second or third migration process. So they have lived in different countries such as Peru, Ecuador, Panama, any other before coming here. So they were used to the Venezuelan system. Then they got used to the Colombian or Panama system. And then they are coming here and they do not know those legal resources or how to get legally integrated into society, and not having that work permit that keeps you in illegality, just that they are just allowing you to be here, but not to integrate and work here. So that's a gap that I see in those challenges.
That's really helpful, Miroslava. Thank you. Yeah, I think that's a really important point about how individuals haven't just come straight here. They've already navigated multiple other systems in multiple other countries in some cases. Yeah. Ina, did you want to add anything?
Well, I thank you for all your input. It's just to add what Pedro said in mental health. You know, Venezuelans are very resilient, and we have to suffer so much, you know, to be, when you said you have to migrate or you have to move out, it's because you have experienced a lot of trauma. If you ask me, I've been gunshot, like my mom had been gunshot in the head, many robs. We have had kidnapping situation, not only once, several times. and we stay there hard. We're gonna work. My parents, oh no, we're gonna rebuild. We're gonna ask how many Pedro family rebuild themselves in Venezuela. I live with them. I believe what when they say 4 kids, I'm gonna migrate. I was like, Liz, are you gonna? Yes, I have to go for future. I was there in their decision, my parents' decision. Is families, is we have to, I have to say something when Pedro was saying, like, I last weekend I went to Aruba because my kids, I cannot take it to Venezuela. What is the closest thing that I can say, hey, this is a water similar to Venezuela? I went to a point and I climbed a rock and said, over there is my country. To my kids, because I'm afraid that if I go, they can do something bad to them. They can kill them. And that's terrible because, as Pedro said, oh, if people go, it's very hard. My parents are here. They're 75 years old. They can know, they don't have their family, the social network. They feel lonely. It's very, very hard. And then I want to go to the doctor. No, it's but they said, your mom need company. Your mom need a support system. So that's why it is, I really appreciate all you're saying, but we are so resilient. We suffer so much trauma and we don't talk about mental health. We're not, nobody. This is no way, because if you say that you're crazy or you're weak, and Venezuelans are tough. And you fall down, you're not allowed to cry. Venezuela, you're not. You can stand up and move on. So that's the biggest thing with my kids. Like you're saying, you can cry. And my parents are taking care of them today. And it's my hard thing is what they're gonna say, because my parents are very tough. Like you have to be strong. And this is who we are, a strong people that can. I know we have bad things and good things, but that's what I want to say. Resilience is our big, I can say like say that we're resilient, we're strong, but also we're weak too and vulnerable. So that's the only thing. Sorry for the time.
No, I think that's really helpful, Ina. And I'm just wondering, if you all were speaking directly to individuals from refugee resettlement agencies, from community-based organizations who wanted to provide mental health care to Venezuelan migrants, what are some of the most important things that you would want those mental health care providers to know about interacting with Venezuelans specifically? Yeah, Pedro.
Yeah, and like I said at first, I think the first, and I think this is a point that I really want to emphasize, is the language barrier. I think that the language barrier is 80% of the hurdle, because if you're able to communicate with people at their level, then there's flexibility elsewhere. So making sure that providers are intentional about either hiring staff that are Spanish speaking or outsourcing to some sort of interpretation services. There's virtual options, but just making sure that that resource is available is really, really important. And then, like we've been mentioning, right, our threshold of trauma is really high. And so being able to educate the community in a way that is not prescriptive, in a way that is not diagnostic, to say, loneliness is actually a problem that can be addressed. And speaking it that way instead of using, medical language that I think scares us away, because of the fact that we are strong people. We are raised to be strong, and we've seen so much suffering that for us to complain, it's like, well, there's somebody else in our community that's had something even worse happen to them. So who are we to say, oh, I'm so depressed and I'm so anxious, when there's people who have their children kidnapped and they haven't seen them for months, right? So I think understanding that and being cognizant to the fact that it's difficult for us to even admit to ourselves that there is a mental health issue, and being able to kind of coax community in a social and informal way, to lead them to the conclusion that, hey, this is actually something that we can address.
Yeah, that makes sense. It sounds like approaching individuals in a more kind of like holistic way, and perhaps avoiding things like depression, anxiety, these more clinical terms, and talking more about support, loneliness, kind of thinking about more mental health is kind of more holistic as opposed to a clinical way.
Right, asking questions that maybe kind of lead to the answer instead of directly asking them, because once you use buzzwords like anxiety, depression, we're like, no, that's not me, like I'm not. But then if you say, well, when was the last time you went out with a friend? And when was the last time you made a phone call to family in Venezuela? Things like that that are symptoms of loneliness without abridging it directly, because it will scare people away. I mean, even myself, right? Like I have my own psychologist, and it was a hurdle. I've been through so many, just because there's a point where I'm like, I don't need this anymore. Like this was just for the moment, but I'm good now. Like I've cleaned it off, I can keep going. And so I think that's really important.
Yeah, thanks, Pedro. Yeah.
And I wanted to say, I work in the hospital, right? And then one of my roles is to educate providers on different type of topic. Diabetes is one of my biggest one. But I think when you ask the question, what could I do to all the residents and then the doctors that I'm seeing the Venezuelan community, is this lecture, like understand the issue. And when you understand where the patient comes from, you are able to understand the situation, because there's a lot of people as a provider, this patient is not understanding me, or the people, doctors have very limited time, 15 minutes to see a patient. In 15 minutes, you cannot assess the whole situation that happened. And that's a huge thing. So, but if I really go to MRA primary care clinics every week, so we can plan something. But I think the residents and the new people, if they understand not only Venezuela, all the immigration system, and then what are they suffering? Because what they prescribe, oh, you can take this or you can take that. As a parent say, oh, do you have depression? My mom will never answer depression. Like nobody is depressed. They are depressed all, but they are nobody depressed. So, or nobody has trauma. Is there no trauma? I had a gun in my head, but no trauma. I don't know. What is that? So I think educating the doctors and making all those comments and I already know, okay, you have a person that migrate, have this social background, send it to a psychologist, a therapist, and they have like doctors use a lot of cheat sheet, what to do. So if we create like a 10-point list. That's what I'm doing for the primary care for diabetes. This is what the 10 important things that you have to do if you have a patient with diabetes. Because of the limited time, we can do that for what are the 10 or 5 important things that you have a patient in front of you that is immigrant, that have barriers on food. Like food is such a determination of health. Access to food is expensive in this country. So where to send them to get the food, the no food stamp? If you don't have, they're not eligible for that. But where are the food in the churches? They can get healthy food, or where can they get access? So that's important thing. I think creating a cheat sheet and distributing on the hospitals and the communities and things like that could be good. And empower the Venezuelans or any immigrant. You have the right to do this. I was thinking last night, like go to the places like the restaurants or the places and have a person there, like they can talk and advocate for that. That could be good.
Yeah, no, thanks, and I think, your point about connecting access to food and other basic needs and mental health is an important connection. That it's hard to be in a good place mentally when you don't have access to basic needs, right? And those social determinants of health are so critical, and we can't just address mental health without also addressing basic needs. Yeah, Miroslava, jump in.
From a migration policy perspective, I think there are I think in terms of policy design and making. So in terms of a nonprofit trying to build a program or design a program for better approaching immigrants towards mental health, I think that there are 2 or 3 points that I would like to point out and acknowledge for designing this. And the first one is that taking into consideration not only Venezuelans, but Latin American culture and their non-cultural awareness of mental health, and that mental health is actually an issue, because we say when you go to the psychologist, like it's commonly culturally labeled as you are crazy. So we cannot just push this barrier by force. We could do it first towards a first stage that could be a groupal mental health, like doing a mental health group within, it could be the refugee camps or the refugee shelters where they are at. And let's remember that right now, refugees are being treated as homeless, and they are not the same. Even though we're trying to put them all in the same melting pot, they are not the same. So they cannot have the same type of housing, but that's a different study. So in this sense, I will do first group mental health sessions in order to softer acknowledging what mental health means, and that we all can share different support groups. Pretty much likely like the different women who have been victims of sexual assault or domestic violence, that they firstly do like a group mental health awareness, that this is not okay. And when they share common like backgrounds or experiences, they feel more comfortable of attending to one-on-one therapy. So I think that will be a first step that I would do. Then acknowledging that there are higher traumas in different migration processes. So it's not the same from people who migrated in the 2000s, 2005, or 2010, from people who had recently migrated through the Darien. So they are higher traumas in that sense. People who have been kidnapped, victim of human trafficking, victim of immigrant smuggling, they have been raped, they have been deported from other countries, they have been illegally trafficked. So those are different traumas, or they have been through the Darien Gap, which is a huge rainforest, where they are different non-state actors. So that's something that I will do a training for these mental health providers, to be acknowledged that they are different levels of traumas in this community. And also I will do a training with them for them to be acknowledged of the barriers towards the immigration policy that these refugees face. As I already mentioned, the access to a social, how is the gap in between getting a social security number and getting a work permit, and why are we living in vulnerability, or like being aware of what is that migration policy that keeps them apart from integrating into society. I would say that that's how I would suggest that.
Yeah, I think that's really helpful, Miroslava, for providers to not just have an understanding about culture and all of the challenges prior to and during migration that individuals may have experienced, and also what are the challenges post-migration that they're facing that you mentioned, just kind of getting legal status, work permits, like feeling in limbo in that way. And so yeah, it sounds like there's kind of understanding pre-migration, migration, and post-migration challenges are all simultaneously operating in some way. Pedro, we have just a few minutes left, so why don't you jump in and then we'll finish up. Oh, you're on mute.
Yeah, for the sake of time, I'll try to be brief. I just wanted to comment, right, that definitely our status of Latino health report in 2023 overwhelmingly showed that status equals health seeking. So there's a high number of Latinos that once they're provided with some sort of immigration status, some sort of pathway, they will at a high rate seek care. And this was clearly shown with a study of the documented population. Once the DACA was handed out, a lot of those who otherwise would not seek care started to seek care and started to establish care, continuous care. But I think as we're talking about the context, I do want us to be mindful as well of cultural humility, right? I think that nobody's experiences are going to be the same. And I think Miroslava also pointed that out, right? That it is really, really important as providers to have this context, but also when facing community members to also know, right, that we don't have all the answers, that each story is different, and that we just need to play the role of the listener to ensure that community members feel comfortable and that we're not assuming or that we're speaking on their behalf.
Great point. Yeah, thank you for that reminder, Pedro. I wonder if we could just end today. We've talked a lot about some of the pre-migration and migration and post-migration challenges, the traumas, the difficult barriers that Venezuelans have faced and continue to face. I wonder if we could just end today with the three of you sharing briefly what you think and what you would want providers and other CBO staff to know about the strengths and assets of Venezuelans. Talk to us about that. Miroslava, you want to go first?
Can I go last? I want Ina to
You
go
could
first.
go last. Ina, why don't you jump in?
Figuring out that we're pretty resilient, so I would like to give her the stage, the floor.
Yes. Ina, would you like to share anything?
Yeah, I want to, well, thank you for that position. I think when you ask about Venezuela, we're happy. We're happy people. We the only thing that I can see myself and everything is music. In my house, when I feel down, I just put music, and it's immediately our life change. We are happy people, no matter, we can tell you the more horrible situation that we face every day. And then we put music and our spirit is up and we can conquer the world. Is that easy for us because we grew up with music, we grew up with happiness. And as Pedro and Mutlava said, that we grew up with harm, like we grew up with hardship every day. So for us, things that struggle, like for example, I work and then people hear, oh, my boss said that to me, or things like little things, they vanish, they cry. We don't. We continue to push forward. We are grew up with very resilient and happiness. We always look, okay, what is the next action? What I have to do? Of course, we go down and we go to the issues, but we're resilient and we're happy people, and we want to do the best. We live our country to conquer a better life and better future, and that's what we want. We want to be better. We are here to have a better future. And one example is Pedro. For me, it's really a big example. Really, I saw how his family came, and it's what I'm saying is for generations. Pedro family, you have it here. His future was not this one that you're seeing here. You see Pedro's success, going to Emory School, went to Harvard, went to Europe. Many things that he accomplished, he could not have that done in Venezuela. Never. So, and his family, his future families, his generations are going to be better forever. So when you migrate and you move, you're not talking about you. You're talking about your whole family. Your whole destiny forever is going to change. So if you think about that moment, that's that little thing that the effort that you're doing every day. My husband's father moved from Taiwan, and he conquered so many. The Ku Klux Klan took him out of the residency, but he survived. He's here. He lived in. His kids are living the future of this beautiful country, because we cannot forget that America is a good country. America is a country that is open the opportunity. If not, we cannot be here. So that's important, that don't forget, of course, there are challenges, but America is a country that is given the opportunity to grow, the opportunity to work, the opportunity to live, and our future generations are going to be better. And one day, we can give back to Venezuela when it's better. One day we love our country. If you tell our parents, I want to visit back home, I want to invest, I want to give my knowledge in diabetes, in all the things that I have to improve Venezuela. I hope that, but the government doesn't let us. So this is beautiful, giving you we are resilient, we're happy, we want the best, and we want the best for the future generations. So thank you for this opportunity, and thank you so much for being here.
Thanks, Ina. That's such a nice message. Appreciate that. Yeah, Pedro, why don't you add, and then we'll wind things up with Miroslava.
Yeah, no, I mean, I think there's really not much to add. I think Ina did a fantastic job of kind of summarizing it. I think we're very much a resilient people, and I think that is our strength. We are not kicked down easily. We're very hopeful. We're hopeful for our nation. We're hopeful for our future, and for the future of our family. And by result, the future of this country. I think a lot of Venezuelans, if not most, come here wanting to build something, not just for ourselves, but for everybody. And so we are very much community people. We're family oriented, and we want to be involved. And I think that's one of the reasons why the loneliness is really affecting our mental health, because in Venezuela, we're social. We like to talk, we like to gather, we like to eat together, we like to listen to music together. And so that's something that really unites us. And when you kind of lose it, I think it,
Yeah, that makes sense. Yeah, thanks. Yeah, Miroslava.
Okay, I would say something that it's pretty outstanding from Venezuelans is that we are multicultural and we're diverse. And it is because we had a lot of European and Colombian and South American migration to our country during the 80s and during the 60s. And I think that that's something that we should acknowledge, that we know how to receive and host immigrants. And right now we're learning how to be an immigrant, but we were never close to immigrants. We were always open to immigration. So I think that our adaptability to foreigners and integration towards foreigners, because we turn them into an important part of our economy and community. And I believe that we all have like different backgrounds. For example, my family background is Czech, Venezuelan, and Peruvian. And I believe that most of you have, whether Italian or Spanish or any other background, or even American, because many Americans came to Venezuela during the 40s. So I think that that's something that I would acknowledge, that we have a diverse and multicultural background and influence, and that we are pretty open to multiculturality, and that we want to be here and settle down here because we cannot settle anywhere else, but also because we want to, and because we want to be part of the community. So for us, being part of the community, as Pedro said, being part of the family, because for us, our neighbors are our family as well. So being part of that community is what will take us to the very integration and settle down. And that's why we should improve also our mental health and that cultural awareness of how the American society works as well. And I think that that's why loneliness is a huge challenge and struggle for us. And we are resilient, but also we want to do things right. It's just that many of our recent immigrants don't know how to do it because they do not understand the system. So that's my biggest message that I will give, and that this country, as ours, is made of immigrants, and that definitely we want to make a better country for us, but also for Americans.
I think a perfect place to conclude for today. Just want to thank Val for organizing this webinar, and thank you to our three panelists. All of you really, I think, raised our consciousness about some of the issues, and as we all are hopefully aware, this was just scratching the surface of our understanding, but I think it will be impactful for all that are currently watching or will watch this in the future. So we really appreciate your sharing your experiences, being so willing and forthcoming about your experiences and allowing us to learn from you. So thank you for your time today, and we look forward to future discussions at some point. Thank you all.
Thank you all for everything. Thank you, Ball.
Thank you.